Hi, my name is Annie Mills, and welcome to Veterinary Dentistry for Technicians. I'm a licensed veterinary technician with a VTS in dentistry, and I've put together this 8-hour comprehensive course specifically for technicians in the general practice. The first technique that we're going to talk about is the parallel technique. And the good news is this is a very easy technique to master. It's very simple. We've got the sensor placed behind the tooth, and we take our beam or our tube head and aim it directly perpendicular to that sensor. So we're shooting through the tooth right onto that sensor. This can indicate most likely a non-vital tooth. It sustained some sort of trauma where it didn't fracture the tooth, but it irritated the pulp chamber enough where it actually killed the tooth. And so this discoloration occurs. Here's the corresponding tooth on the x-ray, and you can see that wide pulp chamber.
With most ultrasonic scalers, you should have two tips that you're going to be using. One is specifically for the crown. The other is specifically for subgingival ultrasonic cleaning. So make sure that you've got the correct tip on if you're going subgingivally.
All of these teeth are missing, but we've got retained roots associated with these teeth. So that's RTR, and we just draw some arrows to indicate where those roots are. And again, this is based on our radiographs. And so we're going to go in and block everything and extract all of those roots. And the landmark that you're looking for lies above the distal root of PM3. That's the infraorbital foramen that enters the infraorbital canal. And when you lift the lip dorsally, you can feel that ridge of bone, and you can see it's kind of an envelope opening. So you want to have your syringe and your needle pretty parallel to that maxilla. So it makes you more effective in assisting and anticipating what the next step is and to be ready for that. So the veterinarian can move along and get this done as quickly as possible.